The first thing you need to do if there's hair covering the area you want to sample is to clip the hair. This dog has very good-looking skin, so it's going to make it more difficult for us to determine where we want to take a sample. So what we're going to do is take a permanent marker pen and mark a site that we want to biopsy. So for instance, right here. We need local anesthetic at this point, so I'm going to use a 22 gauge needle to draw up some 2% lidocaine. I'm going to drop about 2.5 cc's. This will allow me to take 3 to 4 samples using the same syringe. And it's been shown that lidocaine can sting, so the way we make it a little less painful is to combine it with between 1/4 and 1/2 cc of 50 milliequivalent or 8.4% sodium bicarb. So when you drop the sodium bicarbonate, sometimes the solution starts to turn a little bit cloudy. At this point now, I like to change needles and put a 25 gauge needle on the syringe to introduce my local anesthetic. A local anesthetic is a subcutaneous injection, just like a vaccination. So since this is where I'm going to sample, I can tent the skin and just do an injection and inject about 1 cc of material under the black circle that I've drawn on the animal. So now that area should be anesthetized. We're going to use a 6 millimeter biopsy punch to take this sample. That provides us enough material for the pathologist to give us a good anatomic diagnosis. You can use a 4 millimeter punch, though, if you're going to sample a smaller animal, a smaller site, maybe a nasal planum or a foot pad. I like to tense the skin. You place the punch over the area where you've blocked with anesthetic. You put gentle pressure on the punch and turn it in one direction. It's almost like corkscrewing a bottle. This is a cutting instrument, so it will cut through the skin. And you turn it and press until you're just through the skin. And when you lift your punch, the sample of skin is almost completely detached from the surrounding area. At this point then, you take a small forceps and gently grab the tissue by the subcutaneous tissue, trying not to crush the epithelium, lift it and cut. I like to set it aside while I place a suture in the skin. You can either use a simple interrupted or a cruciate suture. Most of these are done for cosmetic purposes. And generally, when the suture is removed in about a week or 10 days is when you have your biopsy results back from the lab and you can discuss the results with the owner.